Today we will discuss abdominal aortic aneurysm, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. An abdominal aortic aneurysm, AAA, is an enlargement or bulge in the abdominal part of the aorta, which is the large blood vessel that carries blood from the heart to the rest of the body. Think of it like a balloon that's getting too big and could potentially burst. Symptoms. Many people with an AAA don't have symptoms, but some signs to watch for include pain, a deep constant pain in your abdomen or back, pulsating feeling. You might feel a pulsing sensation in your abdomen. Other signs include sudden severe pain in the abdomen or back, which could indicate a rupture, and this would be considered a medical emergency. How to know if you have one. Screening. Doctors often recommend an ultrasound for people at higher risk, like older adults or those with a family history. Physical exam. A doctor can sometimes feel a pulsating mass in your abdomen during a physical exam. If you're concerned about your risk, it's best to talk to a healthcare professional. If someone has an abdominal aortic aneurysm, here's what to do. Stay calm. Stress can make things worse. Seek medical help. Call a doctor or go to the ER, especially if there's sudden severe pain. Follow the doctor's advice. If diagnosed, the doctor may recommend monitoring or surgery, depending on the size and the symptoms. Avoid strain. Don't lift heavy objects or do intense exercise until cleared by a doctor. Regular checkups. Keep up with the doctor visits to monitor the aneurysm. Always follow medical guidance for the best care. In the hospital, if someone has an AAA, the medical team will typically do the following. Number 1, assess the situation. They will check vital signs and symptoms to understand how serious it is. 2, imaging tests. They may use ultrasound or CT scans to see the aneurysm size and location. 3, stabilize the patient. They will give fluids and possibly blood to stabilize the patient. Surgery. If the aneurysm is large or has burst, surgery may be needed. This could involve open surgery, making a large cut in the abdomen to repair or replace the affected part of the aorta, or endovascular repair. This is another surgical procedure that involves inserting a stent through a small cut in the groin to reinforce the aorta without a large incision. Number 5, monitoring and recovery. After surgery, the patient will be monitored closely in the hospital to ensure recovery. The goal is to prevent complications and ensure the person is safe. For an AAA, there aren't specific medications that treat the aneurysm itself, but certain medications may be used to manage related conditions or risk. Here are some commonly used types. Blood pressure medications, such as beta blockers, example metoprolol or atenolol, help lower blood pressure and reduce stress on the aorta. ACE inhibitors, example lisinopril or enalapril. These help relax blood vessels and lower blood pressure. Number 2, cholesterol-lowering medications, such as statins, for example, atorvastatin or simvastatin. These help lower cholesterol levels, which can reduce the risk of vascular problems. Number 3, anticoagulants or antiplatelet agents if necessary. Aspirin or clopidogrel. Aspirin may be prescribed to prevent blood clots. Clopidogrel, another option for patients at risk of clots. Always consult a healthcare provider for the most appropriate treatment option. People at increased risk of developing an abdominal aortic aneurysm include older adults, especially those over 65 years old, men, they are more likely to develop this than women, smokers, smoking significantly raises the risk, family history, if someone in your family has had an abdominal aortic aneurysm, you might be at a higher risk. High blood pressure. People with high blood pressure may be more likely to develop this condition. And high cholesterol. Elevated cholesterol levels can also increase risk. Being aware of these factors can help in taking preventative measures or seeking medical advice early. Now you need to watch my video on Staph aureus or have a look at pneumonia.